The procedure that's giving hope to cancer patients without much left. But who can actually qualify is extremely selective. Staying ahead of an opioid abuse problem, how Fresno Heart and Surgical Hospital doctors are changing the way they manage post-surgery pain. Plus, the surgery that saved one Clovis man's limb and his love of the game. Hi there, and thanks for joining us. I'm Julie Musgrave. Right now, there is a groundbreaking cancer treatment option available at Community Regional, the only place in the Central Valley you can get it. It's for certain patients with specific cancers and little hope. It's called HIPEC, hyperthermic intraperitoneal chemotherapy, a method of heating chemo and putting it in direct contact with cancer. It promises a 60% improvement of survival following a diagnosis.
These are the people that have been told you only have 6 months to live.
Dr. Amir Fati is part of the team that brought HIPEC to the Central Valley. He says to those offered the chance to undergo this treatment, it's a ray of hope.
I received a phone call from my oncologist. She said the cancer came back.
Mario Valles was first diagnosed with stage 3 colon cancer in 2012.
I was very scared.
He underwent 12 cycles of chemotherapy, several surgeries, and still the cancer remained. But then Dr. Fati came along.
We have a very stringent criteria for patient selection because we want to offer this to a patient who would really benefit. And Mario is a great example of that.
HIPEC itself was first introduced just 10 years ago. Right now, the surgery is for patients with cancer in their abdomen only. It can't have spread to other parts of the body. They also cap the age at 65. All this because it's a very complicated process.
We go inside the belly, we take all of the cancer out. This is a very tedious process. Sometimes it takes 10 to 12 hours for us to do this. You have to bring the bulk of the tumor to less than 3 millimeters. And that's when you add the heated chemotherapy to kill the rest of it. Heat increases the depth of penetration. When you heat the chemotherapy solution to 42 degrees, it can penetrate up to 3 millimeters into the depth of the tissue.
I'm ready, doctor. Just let's do it.
Mario is one of the few who qualify, but stringent criteria led to a textbook outcome.
2 months later, I was feeling great, ready to go back to work. I feel like I'm a new man.
Mario is now 14 months cancer-free, and he's looking at many years of staying that way.
Oh, I'm so grateful to him. He saved my life.
Dr. Fati says there is some research being done that could expand this type of treatment from just the abdomen to other parts of your body, like your chest. It's just not happening yet. Happening across the country, there is a serious narcotics abuse problem. Opioids, even when prescribed by a doctor, can be extremely addictive. We sat down with the Bariatrics team at Fresno Heart and Surgical Hospital to find out how they're avoiding the risk altogether. Dr. Ma, Dr. Higa, thank you guys so much for joining us this morning. We're going to be talking about narcotics and how you guys are going to be going narcotic free in your practice. Tell me what exactly that means.
So narcotics are actually a big issue nowadays. It's actually becoming the leading cause of death under the age of 50. So that's really important. It's actually a 19 increase rate of death since last year. And a major part of that is prescription opioids. And so more than a third of percentage of deaths related to opioids is from prescriptions itself. And surgery is a big contribution for that. And so it's important for us to be involved with that because we do a lot of surgeries at Fresno Heart.
Dr. Higa, what will be the biggest difference that patients see?
Well, we're hoping that by instituting specific protocols that they're not going to be experiencing more pain. It's not just about stopping narcotics and saying, okay, you're going to be in pain. That'd be, unethical. But we're trying different methods along with a team of anesthesiologists and pain specialists to give the equivalent or even better analgesia after surgery, after major operations, without narcotics altogether. It's entirely possible. It's been done before. As Dr. Moss said, it was chilling to me to find out that some patients, the first time they got a narcotic was after an elective surgery, and that was the tipping point for them to develop an addiction. Now, we're in the business of saving lives and helping people. We didn't want to contribute to the problems. And so as a group, we decided we're just going to set the bar to be narcotic free, and but we're going to do it in a very responsible way.
So can you elaborate on some of those other methods that you're going to be trying out?
Yeah, we are starting a comprehensive program called the Enhanced Recovery After Surgery, or ERAS protocol. Sounds a little technical, but generally what we're trying to do is educate the patients ahead of time, before surgery, their expectations of pain, what to expect, because all surgeries, you're going to have a little bit of pain, but it's going to be manageable. And so through that, we're also instituting that within our the floor nurses as well as during surgery, and achieving a comprehensive pain management for during surgery as well as after surgery.
And when will patients start seeing these changes?
Well, we've already started some of our protocols now. In fact, our studies show that we've decreased the need for narcotics by 75% with some very simple measures. And so we're trying to take that to the next level. Now, each step is going to be studied and verified and looked at, but you know, I think this is the beginning.
Absolutely. Thank you guys so much for your insight. We sure do appreciate it.
Thank you.
Still ahead on Medwatch today, set down the smartphone, what a new study says about our obsession with staying connected. Plus, we'll meet this week's healthcare hero with a passion for patients who need special care.